Hi everyone, welcome to Career Talk. My name is Duladel Willie Tyndale, and on behalf of Mona Aging and Wellness Center at the University of the West Indies, I thank you so very much for joining us. We truly value and appreciate your time and are very glad that you could be here. Did you know that March is recognized as Careers in Aging Month? Yes, indeed it is, and throughout that month, the emphasis is on spreading awareness about the many and diverse career opportunities that exist in the field of aging. We also use the time to encourage persons to think about how their existing interests can be applied to the field of aging. You know, we're doing this because globally we're experiencing a significant demographic shift whereby persons 60 years and older are making up an increasingly larger share of the population. To give an example, for Jamaica, older adults are now at about 13% of the population, and this is projected to continue to increase until about 2050, when they're going to be 22% of the population. What does that mean? That means that 1 out of every 5 persons will be 60 years or older. So imagine walking in any town, any city, any rural area, 1 out of every 5 persons you encounter will be an older adult. So we have to respond to that. We have to create opportunities for persons who are exploring career options so that people know what is possible, right? We need to respond to the increase in the demand for goods and services. So to help us discuss how we can respond by developing expertise and through offering goods and services, we have with us geriatric physiotherapist and home safety specialist, Dr. Regine Porter. Welcome, Dr. Porter. Thank you so very much for joining us.
Thank you.
Before we start talking to Dr. Porter, I want you to think about somebody who you know who would benefit from this information and share the link with them. Get them to come on over and listen. Now, of course, this is going to remain accessible on our YouTube channel, NAWC TV, and so you can always, go back to visit it. Dr. Porter is going to share with us a little bit about her academic and professional journey and hopefully show you why you should consider a career in the field of aging. All right, so Dr. Porter, let's jump right into it.
Thank you.
Geriatric physiotherapist and home safety specialist. We don't often hear these as occupations, in Jamaica. Tell us about what you do.
Okay, so I am a past student of the University of the West Indies School of Physical Therapy. That's where I did my BSc, and then went on for further education to do my Doctor of Physical Therapy degree, where I specialized in geriatric physical therapy. And along the way, I have done a lot or many continuing education courses, not just specializing in geriatric care, but other areas such as Pilates, osteoporosis. And then while working in the area, you kind of find out or figure along the way, what are some of the things that are lacking in geriatric physical therapy. And then since then, I've been working to fill those gaps.
Awesome. So tell me something though, I'm curious. Was a career in aging, so you did your regular degree in physiotherapy that we all are familiar with, but then you said you went on to do doctoral studies and you focused on geriatric physiotherapy. So did you, from a long time before that, have an inclination or a leaning towards working in aging?
No, actually I did not. So I started out, and a very common area for physical therapists to specialize in is sports. And I was not athletic at all. So I know I wasn't so sold on specializing in sports. But while practicing, I took a liking to osteoporosis and bone health. So that's where that started. And because of the demographic for that disease, I started seeing a lot of older women. And then from there, it kind of just blossomed into not just caring for women 65 and older, but men, and just taking a liking to geriatrics. So at that time, I wasn't sure if there was a specialty for geriatric physical therapy, so that's where my research came in. And then I found a program, and I was like, this is what I'll do. Yes.
So tell me, you're just beaming as you speak. So this question almost goes without saying, but I want you to tell the audience just how satisfied you are with this career.
Oh man, I am completely satisfied. Like my colleagues will tell you, once they get a patient 65 and older, they're like, yep, this is for Dr. Porter. And I'll tell you, working with younger persons, it's fun, it's nice, but what I find that's most satisfying in dealing with older adult patients is that they understand life, their values and their morals and what they want out of life kind of shifts at this point. And what my aim is to help them to maximize on their independence, right? And when you get a patient that wasn't able to move as freely because they've been diagnosed with either osteoarthritis or rheumatoid arthritis, and then getting them to a place of function where they can go on the road or do something that they've been enjoying over the years. It is so satisfying.
Yeah, you see, and that's something that I think many persons don't think about or they ignore because they're only seen as, tiny marginal gains. But it's important. And when older persons express, how they're feeling or what they are satisfied with, they usually relate it to something that they can do or can't do. That is usually where their satisfaction or dissatisfaction lies. So I think it's very interesting that you would mention that. And definitely, I think that, trying to see how people can do what they value, do what's important to them is an important goal, I think,
yes,
to what we're working towards.
Yes.
Awesome.
Yes.
So for somebody excelling in your field, you said that older persons are, they're different, they know what they want, they have these clear goals. What do you think are some skills that somebody who is working in your field will need to master? Hard skills and soft skills. Okay,
hard skills. Careers in aging is very new, especially on our side of the world. So you have to be very good at marketing yourself, for sure. You have to be a good communicator. You have to be willing to step outside of just your area and be able and willing to collaborate with other persons in your areas. In medicine, we know that patient care is not just one person. It's the physician, it's the physical therapist, it's the pharmacist. So, creating that clear line of communication within the profession or other professionals in the area is very important. Soft skills, now you have to be very patient and understanding and caring, empathetic too, because these persons and their families have, especially older persons, you'll notice where their children or their caregivers have gone from looking them at being completely independent. It's different when you see mommy and daddy when you're growing up and they're doing all these things for you, and then sort of overnight sometimes switch to become their caregiver because things have changed, right? So understanding how to navigate that and communicating with the family, for sure, is a part of some of the skills that you really need to foster within yourself, and they come over time too.
They come over time with experience.
With experience.
Do you think there's a place for persons to, more I guess, intentionally try to develop these skills and probably seek professional help in mastering some of these skills?
Sure.
Or do we just wait on, for us to get better?
No. And a part of it too is a part of your training. So I know a lot of post-grad degrees, you get exposed to engaging other professionals, different courses. So these courses help you as a professional as well.
You hit on something very important, because many times when we try to communicate to persons, the importance of doing a course in, say, gerontology or something with a geriatric spin, people go, but the body is the body, and this is just now an aging body, and why do I need a special set of skills to work with this population? But what you've just mentioned, I think there are many little nuances, little differences, little things that will make your caregiving better. I think that persons can benefit from, for sure.
And just to touch on that also, because when I tell, initially when I told persons that I specialize in geriatrics, they're like, why would you specialize in geriatrics? The body, as you said, the body is the body. I'm like, yes, and they're like, but it's the same RA that I would treat. But there's some soft skills and there's some nuances and there are different things that occur within the body that you have to pay attention to, that are markers. Is a very, very important part of geriatric physical therapy is differential diagnosis. I know we all learn that as physicians and physical therapists, but you have to have that extra edge to be very vigilant, to say, okay, this is outside of my scope and this is where I'm going to refer the patient or the client.
Yeah. So I'm intrigued about the home safety specialist part of your portfolio. Tell us a little bit about that. What does that entail rather? Yeah.
Okay, so my senior home safety certification came out of a lot of older adult patients that I was seeing initially were in their homes, and it's all well when we're getting them as independent as they can within the home, but then there were some little nuances that still existed. You know, okay, you're able to go up the stairs a little easier, but how many times are you going up the stairs during the day, right? So I started to seek out now, what are some of the changes that can be made within the home to maintain the independence? So, you know, having the physical therapy background, I was able to still identify some, but then going into this training now really helped me to zero in on things that even myself would overlook. And again, in specializing in that, persons would say, why do you need to specialize in home safety? Like, we're Jamaica, everybody age is in place. Like, you don't need to put special things in place until you step back, get fresh eyes in, and you're saying, okay, but for instance, let me give you an example. A patient with dementia, they live within the home. We know the different stages of dementia, different things that they might go through. But then you're saying to the family, oh, how about you put some motion sensor lights in, so when they get up to use the bathroom in the night, it's okay. Yes, have them help you to prepare the meal, but we're not going to use sharp knives. We're using these instead, so they still feel a part of. And they're like, oh, but I didn't think about that. And that's where senior home safety comes in, you know?
So you provide a comprehensive assessment of somebody's living environment,
yes,
and then you make recommendations.
Recommendations,
awesome.
Yes.
I think that is very useful. We teach our students here about the built environment, and we do include something about the home environment. And I think many persons leave away thinking, okay, yeah, I'll make some changes in my home, but they don't see it as something that can be widespread, throughout, individuals as a thing,
yes,
for us to do. So I really appreciate that. You interact a lot with older persons, clearly, based on what you do. Other than for physiotherapy, do you see, based on all your interactions, some other opportunities for persons in other disciplines to carve out a niche to serve the older adult population?
Oh, for sure. And just right off the bat, IT. It's very important, and we're moving from just using cell phones now to using Alexa and Siri and other smart home devices. So, if you're going to, and a part of, senior home safety is giving families these options. So if you're for instance, you're choosing to have mommy and daddy age in place, and I'm going to say, okay, you can put up a nanny cam, you can use Alexa. You need to, the parents who will be aging in place need to be informed. They don't need to know how everything works, but they need to be informed that these things are, mommy, if something happens in the home, just say, Alexa, call Regine, and she calls me. You don't need to be searching around the house. So IT for sure. Transportation for sure. A lot of times after about 80, or 670, you kind of ease off the driving. So if you have someone who is careful on the road, and not just a regular taxi, sometimes you want to cater to persons who have special needs as they grow older. So that's another area to look into. Nutrition, very, very important. A lot of times you see the changes in eating habits, but you need to ensure that they are eating correctly. Right? And I'm sure that there's a special dietitian or nutritionist that can help with these things. So there are many areas. Don't just limit yourself to what you know now. Research. If an idea comes to you, and if you're in, let's say, IT, I gave IT as an example, or if you're in construction, or if you're in if you're even if you're an esthetician, because sometimes you want to have mommy doll up her nails or her, but she has diabetes. You want to ensure that, okay, if mommy has a diabetic foot, I want her to get the best care. So just read, research, see what is out there. There are so many options. As I tell you, I didn't know I could specialize in geriatric physical therapy until I researched, and I found a program. Yeah.
Okay. And clearly the demand is there, right? I mean, the sheer numbers is creating a demand in itself, but also a person's desire to, I think that the picture of an older person in the last maybe 10, 15 years has changed from what I grew up seeing as an older person. And I think, and that's partly because we're also living longer and living healthier longer. And so I think the rest of, all the sectors need to come together so that we can respond appropriately. I really appreciate that. What advice do you have for somebody who is new to the industry, maybe new to geriatric physiotherapy, or is contemplating pursuing geriatric physiotherapy or any other career that would respond to the needs?
Research. For sure, research. Collaborate. Don't be afraid to ask questions of persons who are in the field, persons who are outside of whatever area it is that you're working in. Be confident. You have something to offer. I believe that we all have something beautiful to offer. So be confident in whatever it is that you're bringing to the table. Be open to suggestions. Be open to criticism. As I said, we're very new to careers in aging, especially on this side of the world. Collaborate with people all over. If you're thinking of bringing something new to our population, if you find that someone was doing it in the US, reach out to them. Say, how did you find this? How did you, what are some of the things or ideas that you could possibly, and come from a place of love. Don't just do it out of sheer money, but the passion. I tell you, passion will take you very far, and people can smell when you just want the money versus really wanting to help them along the way,
Yes, okay, yeah. I think most people who gravitate to careers in aging usually have that kind of love, deep concern, and then it manifests itself in, thinking about all these ways that I can serve a group of people that I really have a heart for.
Yes.
I really appreciate that,
yes.
that thought. So thank you for sharing that with us. We're almost gonna wrap, and I'm sure based on the persons listening and hearing, persons might be interested in reaching out to you. How can they find Dr. Regine Porter? Okay,
so I'm on LinkedIn, and my name is spelled Raejean Porter. So I can be found there professionally. In terms of my physical therapy practice, I'm located at the Clinic of Sports Medicine and Physical Therapy. That's on 6 Haining Road in New Kingston. And I can also be found on Instagram at Myofit. That's MYOFITT.
Okay, and we'll be sure to write those down and have disseminated to all our viewers. Dr. Porter, I want to thank you so very much for taking the time to talk with us today. Just your presence is really enlightening, and we really appreciated the information that you were able to share for our viewers and for our in-house people too. Thank you so very much, and we wish you all the very best as you continue to grow in your profession and serve your clients very well. I would also like to take the time to thank the Mona Aging and Wellness Center team. Some of them are here in the room with us, for working very hard to put this together. Some of them are elsewhere. We appreciate all of you. We also want to thank MITS for giving us the technical support. Thanks to the entire team there. And to Ishmael, who is here in the room with us, thank you. And you, our audience, thank you so very much for joining. Thank you for staying with us. We really appreciate your time and glad that you took it. And we hope you learned something that you can use to improve your life, to improve your service if you're already in service for older persons. Now, let me remind you, Mona Aging and Wellness Center, you of course already know our YouTube because you're here watching. That's at MAWC TV. And you can find this video to review another time. You can also share with others. We're also on Instagram at UWIMAWC, and we're also on Facebook, Mona Aging and Wellness Center. If you're more traditional, you can email us at agingcenter@uwimona.edu.jm. We'd love to talk to you a little bit more about how your interests can be applied to the field of aging. Thank you so very much for joining us. Thanks again, Regine.
Thank you.